Hi everyone, my name is Brittany Hatzinger and I did my senior practicum project over fluid resuscitation in sepsis patients, specifically in the emergency department. Our department is looking into implementing and actually purchased a new device called the Baxter Starling Fluid Management System. So it was kind of my area to research the system and kind of weigh the pros and cons of implementing them into our practice. Typically, when a patient comes in presenting with sepsis, which is an infection that spreads to the bloodstream, our first line of treatment is a fluid bolus, which is anywhere from 2,000 to 3,000 liters, depending on the patient's weight. More recent studies are showing that not everyone can benefit from this type of fluid resuscitation, and that it can actually be harmful for some patients based on their cardiac output. Essentially, if the patient's heart isn't capable of keeping up with the extra volume, then it's going to cause a whole other cascade of complications. So what the Starling system does is essentially measures the patient's cardiac output by measuring their stroke volume index. It's a device where 4 pads are placed along the patient's body, and then the patient is given a 250 milliliter bolus of fluids, usually a crystalloid isotonic solution. And the device then measures how well the circulatory system is compensating for that extra fluid. In as little as 45 seconds, that can give us a good idea of whether or not this person would actually benefit from a large amount of fluid resuscitation, kind of giving us an idea if we need to do the fluid resuscitation or if it could be more harmful. The monitor comes with the monitor itself, a power cable, a patient cable, and a pack of sensors that can last up to 48 hours. This is the YouTube video that you can visit. It's a great tool to kind of learn the device, learn how to troubleshoot, how to set it up, and how to use it. This is a current copy of my hospital's fluid resuscitation protocol. Several studies have been done on the Baxter Starling system. One of these was called the FRESH study. The FRESH study involved 13 different facilities that implemented this device in their units, and the results were incredible. They saw 50% less mechanical ventilations. Patients spent half the time on pressors, and 20% more patients were sent home instead of being transferred to rehab facilities for lasting complications. Kansas University also did a similar study in which the facility grouped patients into different categories, such as using the device on some patients and using the current management system on others. And their results were similar to that of the FRESH study. 2/3 less dialysis use, it cut their pressor use in half, a 3-day less length of stay. So the results were pretty cool. Using the Starling fluid management device in practice is just another way of catering to a person's individual needs in order to create the best environment for recovery. These are some of the references I used. I hope you enjoyed my presentation on fluid management.